Have you ever started a difficult conversation, hoping for understanding, only to be met with a complete wall of disbelief or resistance? It can be incredibly frustrating and disheartening, especially when you are trying to help someone you care deeply about. When approaching a loved one about potential addiction, preparing for denial is not just helpful, it is essential. Denial is a very common defense mechanism in addiction, serving as a shield that protects the individual from uncomfortable truths and the overwhelming emotions associated with them. Expecting denial allows you to respond with compassion and strategy rather than surprise or anger. The core mechanism behind denial is a combination of psychological coping and the brain changes caused by addiction. As substance use progresses, the brain adapts, and the individual often genuinely struggles to see the full impact of their actions. It is not necessarily a deliberate attempt to deceive you, but rather a distorted perception fueled by the addiction itself, making it difficult for them to accept reality or acknowledge the problem. To navigate this, focus on concrete actions. First, choose a calm and private setting where both of you feel safe. Next, write down specific instances and observations, using objective descriptions rather than accusatory language. For example, instead of saying you are an alcoholic, you could say I have noticed you are missing work frequently and your mood has changed a lot lately. Remember, you are sharing your concerns and observations, not delivering a judgment or an ultimatum at this stage. A key insider tip is to practice active listening even when faced with denial. Allow them to express their feelings without immediate contradiction. This technique, often used by professionals, helps create an opening for dialogue instead of shutting it down. Also, research local resources and treatment options beforehand, so you are ready to offer concrete support if they show any willingness to talk, emphasizing hope and recovery rather than just the problem. By anticipating denial and arming yourself with specific, observed facts and a plan for compassionate communication, you transform a potentially volatile interaction into a productive exchange. This preparation not only protects your own emotional well-being but also creates the best possible environment for your loved one to eventually hear your concerns and consider a path towards help and healing.